John, you've been on dialysis now going on about 8 months. What are some of your thoughts about transplant?
Well, I've thought about it, but I'm not sure if that's the right option for me yet.
It is okay to stay on dialysis, provided you have gone to a physician, gone to a transplant center, talked to your nephrologist, and you understand what are the options which are available for you, and you know what are the upside and what is the downside of all the different options. And if you consciously make a decision that, yes, I know everything about transplant, I do not want to get it, I want to stay on dialysis, I think that is perfectly all right. But a lot of times when I talk to people or talk to patients, I kind of get a sense that a lot of people don't know different options that are available. You know, when I tell them the facts about transplant, they suddenly say, nobody told me this.
What do I need to know about getting a transplant?
When deciding whether to get a kidney transplant, it's important that you understand all the possible medical, psychological, and financial risks. You can stop pursuing kidney transplant at any point if you decide this is not the right decision for you.
My doctor's recommendations about getting a transplant, he said, you know, based upon how active you are now and personality, he says you're in great shape except for having this bad kidney. He said, I think you would be a viable candidate.
Hey Daryl, how are you?
Fine.
How you been? Good. Just coming here to talk to you a little bit more about this issue about transplantation. Just trying to compare how life is and how life could be. What limitations do you have for daily activity right now? What things you cannot do that you would like to do?
Drink a beer. Coca-Cola. Big Mac. Walk into a restaurant and don't have to worry about, I can only eat this little bit. Just drink some water. That's a blessing. And it might sound funny just to pee again.
The reasons to have a kidney transplant are you're going to feel better, you're going to be able to drink more fluids, you can travel, you don't need dialysis, and you're going to live longer.
I appreciate dialysis, but what is the next step? Dialysis is still not allowing me to live the life that I want to live, and I want to go back to as close as that normal life I was living. So I wanted to know what were my options. And when I found out transplant was the closest thing to a cure and feeling as best as I can the way I used to feel prior to dialysis, let's do it. Sign me up.
The reason that people live longer with a kidney transplant rather than with dialysis is because a kidney transplant gets rid of the poisons better. Dialysis approximates about 10% of total kidney function. A good functioning kidney transplant can be 50 to 85 and sometimes even 100% of kidney function with one kidney.
When I was on dialysis, I said, I think I'm too old to have a transplant. But anyhow, I talked to my nephrologist, say, what's the oldest person that you've known that had transplant? He said 76. I'm still 72. I can still do it.
But we think that transplant is a good option for a lot of people that really don't think that it would be a good option for them. They think they're too old. They think they're too sick. You may have been sick in the past, but it's how is your body now? Can we do surgery now?
Having diabetes didn't limit me from getting a kidney. It, because diabetes caused it. It caused my kidney to fail.
You can have a kidney from a person who's living, a living donor. That living donor can be your relative, can be your boyfriend, can be a church member, can be your cousin. There's so many people who can donate a kidney to you when they're still living. There's also a deceased donor. A deceased donor kidney comes from a person who's passed away and has donated the organs for transplantation. So I wanted to make sure that you call a transplant center and be evaluated.
Find out if you have any willing living donors. Get a referral from your doctor to get on the transplant waiting list. And notify your insurance if you have insurance and get the ball rolling.
Sounds like you're kind of interested in transplant. Sounds like you'd at least be interested in getting a deceased donor transplant?
Yes.
Okay, so we need to get you on the list for that, first of all. I've told you that medically you're going to do better the sooner you get a kidney transplant. The average time to wait for a kidney transplant now on the waiting list in the United States is about 4 years.
I decided to get on the transplant waiting list because I wanted a kidney. And if I'm going to be on dialysis and waiting for something, that seems like the best possible thing to wait for, a new kidney.
When it came down through the process that I was really to a choice of either having my daughter donate the kidney or going on a list with a beeper, it really was at that point meeting with my daughter and finding out that she really wanted to do this. She wanted to do this more than I didn't want her to do this.
Can I get a transplant faster if I have a living donor?
There are advantages, usually because you know exactly when your testing's done and the donor's testing is done. You can plan for your job, you can plan for family members that might want to come in. It usually is a faster process, although the donors get a complete workup also. They get testing to make sure it's safe for them, because this isn't surgery they need to have. They're doing it out of the goodness of their heart for somebody else. So it's usually a faster process, and everything is planned, and you can kind of plan your life around what's going to happen.
If I decide not to be a living donor for my friend, you mentioned like a transplant waiting list. How would that work? How does that work for her?
She would take the initiative, and we want her to call the transplant coordinators and let her know that she's interested in going on the waiting list. Once she makes that initial decision, a very active decision, then they will follow up with her, and she would go in for a series of testing.
So you're saying that she wouldn't not get a kidney because she's African American?
No. As long as you are eligible to get on that list, as long as you are on that list, your name is there with everybody else.
This particular doctor, she would come to clinic every time she come to clinic to, for the visits. I think she came on every Wednesday, and she would always ask me. She said, "Tyrone, have you gotten on that list yet?" And I said, "No, I haven't." And I just thought I should get on that list, and that's the best thing I ever did when I went and put myself on the transplant list.
In order to make the right decision, you have to be educated about the facts of transplant. That's our job at the Transplant Center. Your job is to call us and ask whether you could be considered for a kidney transplant.